Welcome to Wellness for Life. My name is Missy Lindow. I'm a physical therapist assistant and lifestyle counselor with CHI St. Joseph's Health Weight Management Center in Park Rapids. Our small community hospital has been able to provide weight management services to patients in the surrounding area since 2004. I'm proud to be a member of a team that really specializes in individualized treatment plans for each and every patient that we see. Today I want to take a minute to talk with you about our medical weight management program. Medical weight management involves a multidisciplinary team, and it also allows us to use some FDA-approved weight loss medications to help you meet your weight goals. Why do we spend this time treating weight management? Because we know that weight is directly related with your health conditions. In fact, we have to start by gathering some data. First of all, we calculate your BMI. This is something that some of you might be familiar with. You might have talked with your primary care provider about your BMI already. BMI stands for Body Mass Index, and it's basically a mathematical equation looking at your height as well as your weight to determine your health risk. The graphic on the screen indicates that a normal body mass index is 18.5 to 24.9. The overweight category is 25 to 29.9. This is the area where medical weight management approach can be the most effective. Class 1 obesity is 30 to 34.9. Class 2 obesity, 35 to 39.9. And Class 3 obesity would be a BMI over 40. You can also visit our website to use the BMI calculator located on the Weight Management Center webpage. At your first visit for medical weight management in Park Rapids, we do a thorough evaluation and assessment. This is because we know, like mentioned earlier, that your weight directly impacts your health. The graphic on the screen indicates that your weight impacts health conditions such as high blood pressure, diabetes, obstructive sleep apnea, polycystic ovarian syndrome, and multiple different types of cancer, just to name a few. In fact, if you fall into the overweight category, you are 3 times more likely to have diabetes and 60% more likely than a person of a normal weight to develop arthritis. This is why treatment of obesity becomes so important. Our physician's assistants complete a thorough evaluation and assessment of each patient. They begin by looking at a medical history and reviewing systems, looking for signs and symptoms of things like diabetes, high blood pressure, obstructive sleep apnea. They also look at medications as well as allergies. Our team also completes a family history. They look at things like your occupation, your family, your living situation, cultural beliefs, before we dive into things like nutrition history and physical activity history. Upon completion of the evaluation and assessment, it's time to make some management decisions, and that's the next phase of the process. One of the things we really are proud of with the Weight Management Center is that we employ a patient-centered approach, which means you, as the patient, are in the driver's seat. We need to collaborate not just with you, but also with your primary care provider to make sure that you receive the best care possible. All of our patients receive nutrition intervention from a registered dietitian. The dietitian's role on the team is to help guide the patient through the process of making healthy eating behavior changes. We also work with patients with physical activity, whether it's with myself as a physical therapist assistant or one of our exercise physiologists on our team. We help create an individualized exercise plan that addresses patients' challenges like arthritis, shortness of breath, and just plain frustration with past exercise attempts. Many of our patients benefit from behavioral therapy. What we know is that when it comes time to make changes in regards to what we're eating or how much we're exercising, anytime we look at behavior change, our experts really truly are our mental health providers. We work with mental health providers both in our Park Rapids area as well in surrounding communities to service patients and make sure that they get the help that they need. I also wanted to talk just briefly about pharmacotherapy options. What that means is that there are FDA-approved medications that our physician's assistants are able to prescribe that can help patients along their weight journey. We know and understand that these medicines work best in conjunction with nutrition as well as lifestyle modification and behavior change. Research indicates that patients seen in a medical weight management collaborative model, like the one I've just described, can expect to lose about 5 to 10% of their body weight. Our outcomes at the Weight Management Center in Park Rapids actually indicate about a 12% body weight loss at 1 year. We're very proud of this, and we believe that it has to do with empowering our patients in this process and creating individualized plans to meet their needs, as well as keeping their primary care provider involved. When you are ready to make lifestyle changes to improve your health, we are here with you along the journey every step of the way. I encourage you to give our staff a call. We would be more than willing to help in any way we can to help make you well for life.
Thank you for watching Wellness for Life.